Broadcasting live from the Business RadioX studios in Nashville, it's time for Nashville Business Radio. Now, here's your host.
And hello again, everyone. Welcome to another edition of Nashville Business Radio. I'm John Ray, and folks, this is going to be a good one. I've been looking forward to welcoming Jeff Gartland. Jeff is the CEO of Relatient. Jeff, welcome.
Thank you, John. I really appreciate being here.
Hey, it's a pleasure. Let's talk about you and the work that you're doing at Relatient. How are you serving folks out there?
Well, we're really focused in on something that in today's day and age seems really, really simple. Can I get in touch with my doctor, and can I get myself scheduled for an appointment? And unfortunately, that's harder than it needs to be, John. So what we are really, really focused in on is trying to simplify that problem statement down so that people have better access to the healthcare system. And we really, truly believe in our heart of hearts that people do deserve a more simple solution and a simpler way of accessing healthcare. And so that's really our core focus.
You got my attention on that. I think me and I don't know, only about several hundred million others have that same problem, right? So
I think it's one of those ones that everybody unfortunately has had the experience of, right?
Right.
It's just it is an abrasive process at times.
So let's talk about the problem, and then I want to talk about your solution to it. Why is that a problem? I mean, that may seem like an obvious question, but sometimes there aren't obvious answers to those questions.
Yeah, well, I mean, anybody that's dealt with or has had a family member go through the healthcare system, it can be for something simple, like a normal annual exam or an urgent care visit, all the way to something very complex like a cancer diagnosis. And all of those experiences, the unfortunate reality is there's a lot of administrative activities that happen both behind the scenes and downstream from the consumer experience that we all feel as humans, as patients entering the system. And that can be, related to your health insurance and things like eligibility and authorization and payment processes. It can have to do with referrals and really understanding who is the best doctor to really handle a particular situation. And all of those steps that occur really create these handoff points. And each of those handoff points has an opportunity for yet another challenge or problem statement for the consumer experience. And so what's really gone on for a long, long time is a lot of paperwork, a lot of activity in order to handle those handoff points and handle those transitions. But it hasn't really driven itself all the way up to the beginning where it's the beginning of the consumer experience. Can I get scheduled? Can I get in? The reality, John, is the fax machine is still the number one means of communication in healthcare. It's crazy as much as it is, but the fax is. And so each of those touch points, all of that paperwork, it's moving around back behind the activities. And what our systems are really designed to do is understand that complexity, but then simplify it down so that when you as a human being, one of your family members becomes a patient and is starting to enter the healthcare system, you don't have to worry about that activity. And we can make sure that we support the providers through that process in an easy way and still provide a consumer experience that in today's day and age, we all expect. And I think the pandemic has been a real eye-opener for the healthcare ecosystem, which is kind of shoved us off of the cliff of, balancing between the old administrative world and this new digital world. And it's fully pushed us into the viewpoint that as consumers, as patients, we want a better experience. And that's really what our system is driving at.
So, Jeff, let's, you talk about scheduling, and I want to shift the focus toward another term that you use, which is engagement, because I don't want people to feel like this is some scheduling app that's real simple, because you've got something more than that, right? I mean, you've got something that involves engagement. Talk about that.
Yeah. So the reason we talk about scheduling is because it's oftentimes that first step of engagement. But really that process is multi-pronged. Can you find which physician that you really want to go to? Can you get access to them? Can you schedule an appointment? Can you change that appointment time? What's their follow-up with you? Can you fill out the paperwork ahead of time so that when you get to the office, you're not filling out, 10 sheets of forms? Do they understand your health insurance so they understand whether you're eligible and authorized? Can they take prepayment ahead of time? All of these different steps are really opportunities for engagement with the consumer. And those engagement points can happen before the visit. They can happen sometimes during the visit, and they certainly can happen afterwards and follow up around something like medication adherence, or follow up around, a follow-on appointment or a referral. And so there's all of these engagement points throughout that journey that we're really focused in on, and that our platform supports. And our focus on the scheduling side is really because we've found that to be one of the very, very beginning steps that many consumers are trying to engage with the healthcare system.
No, that makes perfect sense. I think I brought that out in the way I did because I think if people hear scheduling app, they think something a lot simpler than what you're actually providing, right?
Oh, yeah. And scheduling is a really, really, really challenging one. A lot of people think about it as if it would be, going on a Delta website and buying a ticket on a plane. And the reality is it is way more complex than that, because you really do get into the nuances around which physician is best for you and your condition. Let's take a specialty like orthopedics as an example. There's a very big difference between somebody that handles shoulders versus backs. There's a big difference between somebody that does knees versus, hips and elbows, right? And so understanding who and where is the best physician for you becomes quite complex very quickly. And so, this is not like a capability that you're just trying to buy, a ticket on a bus seat or a ticket on a plane. Right. It's really understanding those nuances, understanding the context of what kind of appointment you need, what kind of physician you need, and really bringing those rules into play to ensure that we've optimized the patient experience, the consumer experience, and that we have optimized the provider's workflow so that it's an efficient process.
Folks, we're chatting with Jeff Gartland. Jeff is the CEO of Relatient. I love that name, by the way. I mean, it's like patient and relations. I mean, is that where that came from?
It is.
I love it.
Correct.
I love it. Patient relations. Imagine that. Terrific work. Talk about obviously there's a lot of technology behind what you're doing. So talk about the technology that drives your platform.
Yeah. It really begins at its core around how do you capture data effectively. Most folks nowadays probably realize that, the healthcare provider world has adopted electronic medical records. That's been going on for the last, 10, 20 years, and was certainly accelerated by the HITECH Act in 2008 through 2010 type of time period. And those EMRs are really a core system for the providers. They're this kind of source of truth, if you will, around their patient population and the data and the information that they have. It's essentially a digital version of the old, manila charts that you would see behind a physician's practice. So our technology really begins with how do we effectively tap into that electronic medical record and interface with it in a way that allows for us to surface up that data in a much more consumer-friendly experience. The unfortunate experience of EMRs is that they were largely designed to solve the problem statement of how do providers bill insurance companies and get paid properly. They weren't designed to be consumer engaging experiences. Now we've put patient portals on. I don't know about you, John, but I'm a relatively healthy individual, and I think I have 6 or 7 different patient portal logins for different doctors and places that I've been between urgent care and my kids and a specialist and other kinds of things. And so that's just not a consumer friendly experience.
Right.
I, for one, don't go on to those portals and log in all that often. And so one of the really key things about our technology is tapping into that data, but then surfacing it up in a consumer friendly fashion. And in particular, how do we surface it up through your mobile phone, text messaging? And there's a lot more engagement with consumers through mobile phones versus going on a computer, going to a website, logging into a portal, using usernames and passwords. And so we've really tapped into an ability to securely and safely allow for that experience to be done through your mobile phone, through SMS text, back and forth with your physician. But it does really, truly begin, John, with how do we effectively tap into that data and do so at scale.
Let's. I want to dig in just a little deeper on the text issue, because one of the things that you point out in some of the language you have out there about Relatient is that only 20% of emails are ever opened, but 99% of all text messages are read. And that clearly says people are voting with their feet toward communicating by text. And that's where you've centered your technology.
It really has. Yeah. And it's dramatically changed the game in terms of the ability to follow up with patients, to confirm appointments, to really drive things like the no-shows, and just ensuring that we've communicated and validated that we've got the right date, the right time, sending instructions ahead of time. Perfect example of this is as COVID hit, think about the massive shift that happened from your normal experience with your physician, your primary care physician or a specialist. And then all of a sudden we had to change all of those rules, go contactless, show up outside, we'll call you, and then we'll come walk you in, make sure you bring a mask, all of the different activities that went on during the kind of height and peaks of the pandemic really showed the importance of that communication and being able to do so effectively. And text is just such an easier form and a higher engagement rate with consumers to ensure that communication is read, and that you have the ability to connect people in an asynchronous way, well ahead of the actual engagement inside the office.
So, Jeff, talk about, I guess the customer here for your for this platform is the healthcare organization, I presume. That's who's paying for this, right?
That is correct.
Okay, so let's talk about why it's important for healthcare organizations to adopt your platform.
Yeah, I mean, the really big use cases include driving down no-show rates. So just ensuring that when a patient is scheduled for an appointment, that you can confirm that they're coming, or if they need to change the date and time, that you are able to do that ahead of time so that you can really fill your calendar and ensure that you don't have those open spots throughout the day. So that's a huge component of it. Making sure that you're able to really present yourself in a way that allows for you to capture new patients coming in. Also then validating that once you have a patient, how do you ensure that you're able to really keep them in your ecosystem, and you're validating that they're following up, they're staying adherent to the program and protocols that you have prescribed to them. So if you want to break it down, John, it really starts kind of into or buckets into these 3 easy things.
Got it.
Bring a new patient in and make sure that new patient enjoys that experience. It's a friendly experience and that they show up for their appointment. When I have an existing patient, can I make sure that they are, coming back to me, that I've presented a consumer experience that allows for them to want to continue to leverage my services versus the next provider down the street or down the road. And then when I've got them engaged, how do I make sure that I'm following up with them in a way, whether that's through a referral process or whether that's through, ongoing adherence and health campaigns, that they're continuing to engage with me as their provider. And so it really is new patients showing up, existing patients, staying adherent, and those existing patients following up on what you've really laid out for them.
So Jeff, let's shift gears just a minute and talk about just the little bit of background for you. Big change for you here recently, appointed as CEO of Relatient. Talk about a little bit of your journey and what's happened here recently internally at Relatient.
Yeah, absolutely. So I've been in the business for almost 25 years now. And well over half of that, John, was trying to solve the simple problem, which is how do I just connect the healthcare system? And I've done that in lots of ways, connecting providers to payers, connecting patients to providers, connecting pharmacies to PBMs. And when you've done that enough, what you start to realize is that it's not always just a problem statement of technology. Although I'm a technologist, I'll raise my hand. I'm a tech nerd at heart. But it's not always just a technology problem. It really comes down to how do you drive the technology in a way that aligns to workflows, that aligns to behaviors, that aligns to a lot of these systemic challenges that exist in our healthcare system in the United States. And so I've really been focusing my career on tackling that challenge. And, coming over to Relatient about 2 months ago now, John, what really drew me to it was the ability to have a true impact on how people access healthcare. And it's an incredibly exciting space. And it's one that really has a tremendous impact to consumers and a tremendous impact to providers in terms of easing that burden. And so, the exciting part and what brought me here 2 months ago was we actually merged Relatient, which is based out of Franklin, Tennessee. And we merged it with a business in Atlanta called Radix Health. And Relatient has a huge opportunity now bringing these two businesses together to really be the premier leader in patient engagement and ensuring that we solve not just one of those problems we talked about, John, but really bringing a platform that can help with multiple areas from patient acquisition and scheduling all the way through check-in, registration, and referrals.
And talk about Radix Health. What Radix brings to the table for Relatient, what makes the two of you better together? Yeah,
the big piece that Radix brings to the table is a rules engine that's really, really focused in on the provider schedule optimization. So Relatient has been focused on the problems I'm talking to you about for 7+ years, and has been delivering them extensively at scale across the entire U.S. The one piece that Radix really, really brings to the table is how do we optimize the provider side of that workflow? So how do we ensure that in the example that I told you before about that orthopedist group where, the shoulder specialist is different than a back specialist? How do we ensure that we're bringing that patient engagement experience and optimizing it into the rules that are necessary to make that provider office really work well and flow? And so it's a great marriage between the provider optimization of that engagement experience and the patient optimization of that engagement experience. And that's what we're really looking forward to in terms of bringing that platform together.
Wow, that sounds exciting. Now, you, I guess, concurrently, or you'll have to explain whether it happened coincidentally or if it was part of the deal. You had a major investment from Brighton Park Capital, right?
Yes, and that was part of this acquisition with Radix. Yes,
Got it.
Absolutely. And Brighton's a fantastic partner and kind of financial partner to our business, and we're really focused in on growth, and that's the orientation that we have, is really taking this combined asset to the next level and driving growth into the marketplace.
Jeff Gartland, folks, he's the CEO of Relatient. So, Jeff, let's talk about that growth. Talk about what you see ahead as you integrate these two companies and march forward. What does it look like over the next few years for you?
Well, we're really excited. I mean, we're seeing tremendous growth in many of the market segments. The primary activity that we're executing on right now, John, is very, very focused in on how do we drive that patient engagement experience into a sticky and really, really value added capability that drives the consumers into the provider systems effectively, but really, really delivers tremendous ROI and value for provider organizations. We've already seen great value attainment around appointment reminders, no-shows, a lot of the kind of capabilities that are available today. But we think there's just tremendous runway in schedule optimization and referral management within the provider ecosystem that just removes those burdens. It removes those touch points that I talked about before, where the system can collide with one another, and really provides a technology foundation for the patient engagement experience holistically. As I mentioned, the pandemic kind of pushed the industry over the edge in terms of this activity. So the growth has really been unlocked in terms of demand. It's out there in terms of how do provider systems really open themselves up into a much more consumer-oriented model. And so I think the grass is very green in terms of healthcare ecosystem kind of shaking off the dust and getting themselves out and being a little bit more modern in the consumer experience. And we're really excited to be a part of that.
I've got to think, and this is a question here, but I've got to think that the future looks bright in terms of just the ecosystem out there as you see further mergers of healthcare organizations, as you see some of these big organizations buying doctors' practices, what have you, and integrating them. They're looking for efficiency and to be able to squeeze out added revenue and lower their cost out of all these mergers, right? I would think that's got to help you.
They absolutely are. And, in a simple example of that, John, just take a scenario of a merged organization coming together and trying to drive some level of efficiency around some of their administrative processes, their back office processes. And in today's day and age, maybe they're having challenges with hiring labor. Maybe they're having challenges with getting people into an office. Maybe they're having challenges with, staffing shortages and inability to, effectively handle phone calls in a timely fashion. All of these things are kind of bombarding the healthcare ecosystem due to, kind of the economic conditions and the pandemic. And then on top of it, you've got a pent-up demand in the consumer world that's looking for access and craving that. And so one of the great ways that we can tackle that is just through really good automation. And so we've invested pretty heavily in automating activities around this communication and bringing into the world things like chat capabilities, so that when you're texting back and forth, we're able to make that a much more efficient process with the provider organization, so that they, instead of it taking 10 people to handle their patient population, maybe they can do it with 5, because they're able to use these tools and allow for them to effectively chat back and forth with the patients in a much more efficient fashion. And so it's another great tailwind for us in terms of the pent-up demand, the ongoing consolidation, and then ultimately the ability for technology tools like automation, chat capabilities, a number of the different capabilities that we're bringing to the table in terms of our platform that allow for that to be a really efficient process. And again, like I said, ultimately deliver a really strong ROI for the provider and a great consumer experience for the patients. Wow.
What exciting and important work you're doing, Jeff. Congratulations to you, your team on that. That's awesome. But before we let you go, let's get to a really important question, which is if someone has heard something that makes them want to be in touch, how can they do that?
Yeah, absolutely. So go to our website. It's www.relatient.com. That's RELATIENT.com. Would love to have you look at the information, see what we've got. You can connect with us, contact us there. And obviously, if you want to get in touch with me directly, you can probably hit me up on LinkedIn is probably the fastest and easiest way to reach me. So I appreciate it, John.
Awesome. Jeff Gartland, folks, CEO of Relatient. Jeff, thanks again. Really appreciate you.
Thank you, John.
And folks, just a quick reminder as we wrap up here on Nashville Business Radio. You can find this show on all the major podcast apps. Nashville Business Radio is the search term. We'd love it if you would subscribe to the show if you're not already, and tell folks about it. We'd love to get your support, and we're grateful for that as we tell the stories of great entrepreneurs like Jeff. So for my guest, Jeff Gartland, I'm John Ray. Join us next time here on Nashville Business Radio.